We're looking at data from admissions, particularly across private and public sector in Gauteng in the last 24 hours. The under nines that are in hospital currently are sitting at 7%. So it is higher than what we've seen in the previous waves. But we are comforted by clinicians' reports that the children have mild disease, 7% of total COVID-19 patients. So if I give you crude numbers, we currently have 1,511 COVID positive inpatients across public and private, and 113 of those patients are under 9. In the first wave, second wave, and even in the last wave, we used to have what you'd say classic sign of I can't taste, I can't smell. And then we would worry that this patient probably has COVID. But now some have fever, some don't. In the third wave, we had a lot of patients who also had nasal congestion, sore throat. And now more patients are saying my throat is scratchy more than sore. So the symptoms are very non-specific and they mask and mimic symptoms of flu. The Omicron variant is still new. And also that we don't sequence every test that comes. So it's not everyone who tests positive for COVID who's then sequenced to check whether this is Omicron or not. There are still the other variants circulating. So you still have Alpha, you still have Delta, you still have Beta circulating. And because I've said that the symptoms are non-specific and they get admitted, we test, are you COVID positive or not? And that is incidentally maybe one of the reasons why we are finding a large number of patients who are positive. But I just think that the public needs to be less fearful, but vigilant. So when we send out information, we are saying, be aware. Don't take your 5-year-old's flu lightly. Rather go and check, is this COVID or not COVID?